major surgery each year, with 40% of those being unplanned.
And families preparing to take care of their loved ones after surgery could have a lot on their hands. Dr. Diane Wentz, medical director of the Generational Health Program at Sharp Memorial Hospital, is joining us around the table tonight to talk more about it. Thank you for being here, doctor.
Thank you for inviting me.
So let's talk about senior patients. What do you do differently with them when you're preparing them for surgery?
So Sharp Memorial is the only level 1 geriatric certified center through the American College of Surgeons in Southern California. And we're very proud of that. It means that we have achieved 32 metrics for geriatric care and excellence in the perioperative period. What I want you to think about is, I'm a surgeon, and if I take you to the operating room, it may be an hour or two that you're under anesthetic, and then I'm operating on you. But then it's weeks, months, sometimes years for that recovery to happen. So our program focuses on perioperative optimization of all the social determinants of health, as well as vulnerabilities that affect us as we age.
Okay, so when we're talking about senior patients and say their families and there's this unplanned surgery, what should the families be asking the doctors before they send their loved ones in?
Well, other than the technical aspects of that operation, it's very important to understand what matters in the course of recovery, what matters in the course of quality of life, and what are the deal breakers as that recovery is happening, to where someone might want to switch the course from a medically focused care plan to something else. And we try to tease that out even in an emergent situation so that we're all on the same page as that recovery is happening.
And what about loved ones? What should they expect when, their loved ones are in surgery?
Well, the wait is long, and so I think it's good to prepare to have someone, an advocate, a hospital volunteer, something that supports you while you're waiting for that surgery to be over. And then I think it's critical to really understand every day, what is the care plan? What is our goal for the day, the short term? And what's our goal over the longer term? Where do we expect to be in a week, a month, a year from now?
I know you talk a lot about recovery, but so why are unplanned surgeries different from others when you're at this point in your age?
Well, you think about surgical fitness as the ability to tolerate an operation and all of the stress that that's going to bring, as well as that functional, cognitive, swallowing, breathing recovery that has to happen. And if you're having a surgery emergently, you didn't necessarily get to optimize before having it. So it's similar to, if you're going to run a marathon, let's say, how long do you train before you actually run? And it's the same with having surgery. There is preparation that needs to happen ahead of time.
And doctor, what are the best ways to advocate, I guess, for aging loved ones, for what they want during and after the surgical process?
Having the conversation. Having the conversation about what matters, what's important, what are the goals, what are we trying to achieve, and can we realistically get there with the surgery that's being offered?
All right, Dr. Wentz, we thank you for your expertise and thank you for being here tonight.
Thank you.
Of course, thank you.
Appreciate your time. Still here on Fox 5.